structures and the truth itself. So, studying the psychosocial aspects is very important, both from a dentist point of view, or from a doctor point of view, as well as from a patient's point of view. So, let's study the what are the various psychosocial aspects related to this particular field, related to this special field. While studying the section E, I will request all of you that please sort out the unique topics, please sort out the unique aspects of every topic, as psychosocial aspects more or less they are overlapping with each other, so don't get confused. Okay, so let's focus with the today's topic, that why dentistry is important, and what are the various psychological as well as the social aspects that are linked with the dentistry. So let's first study the significance of the oral cavity. As all of you now have studied the various development theories related to the personality. So can anybody please explain me what is the significance of the oral cavity? Why oral cavity is important as per Freudian view, as per other theories which explains our personality? What is the significance of this oral cavity or the oral stage in short? No idea. Okay, what else? Well, digestion is not important for the personality development. I'm asking, what is the significance of oral cavity for the personality point of view, from the personality development, not for the physical health. I want to relate the oral cavity with the psychological personality. You- okay, what else apart from aesthetics? Aesthetic is a purely social thing, no? Obviously aesthetic is important, but aesthetics is something which is not related with the personality development. It is purely a social thing which the society expects from you guys. No idea. Okay, at least write it down that you guys have no idea what's the significance of oral cavity. But at least interact. Okay, okay. Okay, as per the Freud's theory, oral cavity or the oral region is the first region which we use to ward off our anxieties, which we use to, leave our anxiety, to deal with the anxieties after coming to this world. Now, now, the oral cavity was the first structure which we used while interacting with this physical world, in the form of eating, in the form of drinking, and taking gratification while chewing food. That was the perspective of the Freud's theory, that our personality shapes, we develop our trust while exploring our oral cavity. You guys now must be familiar with the oral stage of the personality, is it or not? Or either you have no idea what is the oral stage of the personality development? Oral, anal, phallic, latency, genital, etc. You have studied it or not? Yes, good enough, good enough. So now, from that knowledge, as we came into this physical world, as a child comes into this physical world, there was enormous anxiety. There was anxiety regarding the survival. There was anxiety regarding the, that how I will eat, how I will, to whom I can, trust. So we first use our oral cavity, we first use food, we first rely on those people who give us food. So in that sense, oral cavity is the way to generate trust in in the physical world, in this world, on the people of this world. So oral cavity is very important in the development of the personality. If in the childhood of someone the trustworthy figure is absent, then in the future personality there would be the lack of trust, or there would be a enormous anxiety while developing the long term relationships. Now apply this knowledge in the current topic, that the oral cavity was the first structure from which we develop the feelings of the trust, from which we develop the feeling that this physical world is the trustworthy. Now that feeling of the trust, that lies deep in your unconscious mind in the form of a defense mechanism known as the repression. Now in the present situation, when we become adult or when we grow older, when this oral cavity becomes sick, or when this oral cavity got disease, then the same feelings of the untrust, or the same feeling of the restlessness, or the same anxiety will awake from your unconscious mind. Now what will happen, that again you will start feeling the same anxiety, you will start feeling the anxious in the same older way. So this is the significance of the oral cavity in while relating it with the personality development. So the dental treatment or the dentistry is something which generates enormous form of stress among both the physicians as well as among the doctors. Even this literature said that the dentists are the more commonly become the victim of the burnout as compared to the other physicians. And in the similar way, when you are doing the survey, the patients also delaying the dental treatment because of the phobia of this treatment. The purpose of the today's lecture is to highlight the issues which generate the phobia, or which are the various factors, to highlight the various factors which are responsible for delaying the dental treatment. Got it? So let's start with it. So among we divided this topic into two broader aspects. One is the psychological aspects and other is the social aspects. Among the psychological aspects, the chief perspective is the feelings of the childhood which are related with the oral cavity. What's written in this slide, the summary is that the oral cavity we used once to gain trust on this physical world. Now when this oral cavity become diseased, the feeling again, the feeling of the anxiety, the feeling of the restlessness, the feeling of the untrusty feeling will again come arouse from your unconscious mind. And when these feelings will generate again, then we will feel the same like helpless, like we will feel the anxious, we will feel exactly the same way like a little child. Got it or not about this theory? Okay, good enough. So the first psychological barrier for the dental treatment is the oral cavity itself. Now see, what are the other barriers? Just go through this slide. First barrier is the cause of anxiety, or the first barrier in getting the dental treatment is the feeling of the helplessness which originates from our unconscious mind because of our childhood as a consequence of the personality development. And second is the position during the dental treatment, as we're lying in a bounded chair, and the physical boundaries are compromising, so we are feeling a little bit threatened, right? And the third barrier is the communication gap, that while getting the dental treatment we cannot communicate properly, and especially if the dentist or the doctor is unaware of the the various communication strategies, then we are unable to communicate. So this lack of communication while getting treatment is obviously causing the anxiety, is obviously causing the panic. Next, the close proximity of the dentist will be perceived as a threat. As our physical boundaries are becoming compromised, we are very close with the while getting the treatment. So this is also a cause of anxiety among the patients the for the delaying the dental treatment. Next is the transference and the negative counter transference. the mixing of the negative associations of the doctor and other authority figure with the dentist. As a dentist, while giving us treatment, he's acting as authority figure, that we are opening mouth on his or her command, we are like spitting on his or her command. So this also will relate that particular dentist with the some authority figure in our childhood. So ultimately it will generate the negative feelings. Got it? Which the phenomena which is studied in the section B. So these are those causes from the point of view of patient. That what are the causes of the anxiety, or what are the causes of the restlessness during the dental treatment? First is the unconscious feelings of the helplessness from our childhood, then is the vulnerable position, and then is the inability to communicate, and then is the physical boundaries are being compromised, and thirdly is the phenomena of the negative counter transference, or relating the dentist with some authority figure to whom which are we are hating. Got it or not? So these are those factors which are generating anxiety among the patients. Is it clear? Okay. So in a nutshell, while getting the dental treatment, these are the few factors, like the bad memories, like not enjoying the loss of control. Obviously during treatment, particularly the dental treatment, we are not at control, right? We are at the sake, we are dentist is controlling us. And third is obviously the pain or the physical aspects of the treatment. And then are the embarrassing thoughts, like the smile, like the smell, lying in the dental chair while opening the wide mouth, etc. So these are the few causes of the dental anxiety. Now, the next thing is the phobia. So, is everyone clear about the previous one? That what is the difference between anxiety and the phobia? Can anyone explain it? Like different people have the height phobia, different people have the water phobia, etc. So, what's the difference between an anxiety and a phobia? Quickly write it down if someone knows it. Okay, and anxiety? Yes, phobia is fear, but which kind of fear? You reached around 50% is okay. Okay, anxiety is uneasiness, good enough. What else? Okay, let me clear one thing between the anxiety and the phobia. Anxiety is something which did not which did not hinder you, which did not put roadblock in achieving a task. You may be anxious while delivering a presentation, you may be anxious while doing a procedure, you may be anxious while attempting for the exam, but that anxiousness, that stress is not putting roadblock, is not keeping you away from attempting the exam, from attempting to deliver the presentation, etc. But when we label something with the phobia, phobia is a condition, phobia is an extreme anxiety which blocks us, which put roadblock in the way of achieving a goal. Now you got my point. So what is anxiety? Anxiety is a feeling which is a feeling of uneasiness, is a feeling of restlessness. But this anxiety didn't bind us, didn't prohibit us while doing a task. Whereas when we label something as the phobia, maybe dental phobia, maybe height phobia, whatever, phobia is a condition, is an anxiety state which prohibits us while attempting a thing, while doing a thing. Got my point? So dental anxiety may be a cause of delaying a treatment, but due to dental phobia, a patient will never come to a dentist, a patient will never visit a dentist, and he will never try to attempt to do the his or her dental treatment. Now, got the difference? So anxiety is a feeling which just make us uneasy, which just make us restlessness. uh, in the previous slides We have just studied the various causes of the anxiety, various causes of the uneasiness, various causes of the a little bit uneasy feeling, etc. But in the coming slides, when this anxiety becomes so much highlighted that a patient afraid while to see a dentist, then we will label it as a phobia. So let's continue it. What are the causes of the phobia? Please uh, clearly remember it, please clearly learn it, because in exam when the question come that write down the causes of the anxiety, you guys wrote about the causes of the phobia, and when the question come write down the causes of the phobia, most of the people write the causes of the anxiety. So let's see what are the various factors which make the dental treatment like nothing. Okay, so phobia is the fear and avoidance of going to the dentist, or the fear of any dental procedure or the treatment. The main cause of the phobia or the main roadblock is the extreme pain, is the bad experience of the patient. Like some patient visits a dentist, he did the root canal, and while attempting the root canal, due to any reason, maybe the anesthesia was not performed, maybe the infection was so severe, the patient developed the so much pain. So what happened next, that the in the future the patient will obviously will not attend any dentist, right? So the first cause of dental phobia is the extreme pain. Then, due to any reason, if the dental anxiety becomes so profound, then it will convert itself into the phobia. And obviously the phobia is the major cause of panic and the terror among the people. Among phobia is something, let me share one thing, that the 8% of Americans, they avoid the dentist due to this dental phobia. Dental phobia is among the chief cause of not getting the proper treatment among the other healthcare conditions. So being a dentist, it is our responsibility, it is your responsibility in future, that you have to do everything to avoid this phobia thing. I will tell you the ways how we can avoid this phobia and this anxiety. Now let's first discuss the, okay, first revise the causes of the phobia. First is the extreme pain or the extreme bad experiences, and the second is anything which which is previously the cause of the dental anxiety. Now this cause becomes so highlighted that it's converted itself into the phobia. Let's see what are the various outcomes of the dental phobia. Now just focus at the top of the loop. First is the dental fear or the dental anxiety. Due to this anxiety or this fear, a patient will delay its visit towards the dentist, and as a result, the dental problems become more severe, and the patient will got the symptomatic treatment, which the patient in the Pakistan, they are doing the most of this thing, that they are not getting any treatment while they are just doing the symptomatic treatment, symptomatic relief. So this loop, because of this symptomatic treatment, the problem will become more severe, and as a result the fear will grow, and when the fear will grow, there will be more delaying visiting, and etc. This loop will keep on going. So what are the signs of the dental phobia? There would, as I said, that phobia is a more severe form of anxiety which puts roadblock, which hinders, which is preventing the patient from getting the treatment. So the signs would be obviously more severe than the anxiety. So what are the obvious signs? There would be a trouble sleeping the night before the dental exam or before the appointment. The feeling of the extreme nervousness, which will escalate while waiting in the dentist room, and crying or feeling the physically ill at the dental chair, or while waiting in the dentist room. Intense form of uneasiness uh, when during the treatment, and the sudden feeling of choking. Just just imagine the any phobia of your life. Every person have the some phobias of any kind, like someone have the phobia of the height, someone have the phobia of particular thing. So just imagine what happened while you are passing through the phobias. Okay, what phobia, what else? What happened when you are seeing the object of to whom you are phobic? First, there is a rush of thoughts, extreme rush, negative thoughts. Yes, डर लगता है. What else? Thoughts, extreme thoughts. And after those extreme thoughts, then there are the physical symptoms like heart sinking, like the choking, like the sweating, like the trembling of the legs, etc. So always remember one thing while studying the phobia of any kind, that the story begins with the thoughts. Phobias, okay, good enough. Yes, these are all the symptoms of the phobia. Good enough. Why I am discussing it in this way? Because if you remember your own phobias, then it's very easy to understand these things, right? So every phobia begin with the thought. Ultimately, after thought, the negative ones, there would be the thought would be followed by the body symptom, like the heart sinking, or maybe the tachycardia, or the feeling of the dying, the feeling of the mouth dryness, the extreme sweating, the trembling, etc., etc. So when you remember all these things in this way, then it would be easier in the exam to yes, the cockroach phobia, the extreme panic, or the extreme screams which you are producing. Now just imagine the situation of a patient who a normal patient, a normal adult patient, healthy patient otherwise, who just comes in the dentist room, and he just have some bad experience in the previous while doing the extraction. So after seeing all those instruments, after seeing all the armamentarium of the dentist, the tray and the instrument, each and everything, a flood of the negative thought will come into his mind. And right after that, all these symptoms which you have just type in the chat box, they will come. The patient will, you will see the patient with all these symptoms. Now just remember these things, this slide, and it will be very helpful in the upcoming slides. It's just an overview that obviously the among the physiological, the pallor, sweatness, etc., all these things will come among the behavioral things, the crying, the pushing the instruments, etc., all this comes. Okay, let's focus on the various causes. Pain, number one cause of the phobia, dental phobia. Then is the fear of the needles or the fear of the various instruments, but this fear all depend upon the previous experiences. These both factors all depend upon the previous experience. If someone if patient with the phobia, he maybe have a negative experience with the handpiece, let's say the dental handpiece or the dental drill, then in the future when he or she will see that handpiece or the dental drill, then he will have the same feel. And then the fear of the anesthesia and its side effects, that maybe it's a local anesthesia, as when you will guy in the next year when you will start doing the extractions, a lot of patient will ask from you that doctor Saab, how you will proceed with it. With either I will got unconscious, either I will develop either it would be a injection, either it would be a spray, or what it is. So anesthesia is always a concern for the patients. Then is the feeling of the helplessness and the loss of control while bounding in the dental chair, as we have discussed in the dental anxiety. And then last is the embarrassment and the loss of the personal space because of the appearance of the tooth, because of maybe the foul smelling, etc., due to these things. So the above factors, the pain, the needles, anesthesia, these are mostly depend upon the previous experiences of the patient. These are not present in every patient. Like if someone got the extreme pain a year ago while taking the dental treatment, then obviously he would be afraid of the pain. Got it? Okay, so now what would be your role in future, that how you can reduce this phobia and this anxiety? So you have to develop a good rapport building is something which put your patients at ease. We will teach you guys while doing the practicals, while doing the practical demonstrations. Right from now, rapport building is a procedure which we are doing while taking the history of the patient, and the purpose of the rapport building is always to put your patient a little bit at ease so that he become comfortable in that dental chair, and he can easily express his or her feelings, right? So without rapport building is just like you're talking with a stranger, and if the phobia is already present, then doing the dental treatment without rapport building is just like a suicide mission, right? The feelings would become more enhanced. Now, if you become successful in doing the rapport building, then obviously you will know how to ask the patient that what he or she is thinking. But without this rapport building, you cannot access the patient thinking, right? As I said previously, that the main cause of phobia, where the phobia originates, it always starts with the thinking, with the thought, with the negative thought. So if we have no idea what's going on in the mind of the patient, then it's impossible that we can relax him or her, right? So rapport building is, yes, important, no doubt, for the medical history taking, but it is extremely important for the dentist to develop it, right? And next is the relaxed and the well organized environment. Well, we are talking about the well organized environment. Then there is only one point which is very important, that the armamentarium or the instrument tray should not be in front of the patient, as mostly dental units they have the instrument tray right in front of the eyes of the patient. So let's say if someone already if someone already associated a dental forceps with extreme pain and with extreme negative thoughts, and you're putting right in front a lot of instruments or a lot of forceps, then obviously the negative feelings will come in an enhanced way. And last but not the least, the dentist should be expert. What is the meaning of the expert? That what we are going to do, what we are doing, you should be expert at it. If you are doing the root canal, then if you are a noob, if you are a if you are a student, then clearly demonstrate it. Took all the precautions like involving someone seniors, at least studying a lot of literature, etc. You should not doing practicals on your patients, right? So what you are claiming, you should have those skills. Next, a dentist should have a profound communication. No doubt communication is very important in all medical procedures, but it has a special relevance in the dentistry. Why in dentistry? Because a patient is already panic, right? Patient is already having a lot of storm going in his or her mind, especially at the start of treatment. For phobia to be successful, there must be enough negative thoughts. What if we interrupt those thoughts, right? So if we interrupt those thoughts at the start of treatment, then the phobia would be much less. You got my point or not? So for this point of view, the dentist must communicate thoroughly during the whole treatment. Like after every 2 to 3 minutes, he must ask the patient that how are you feeling? Is there is any pain? Okay, if there is pain, like there are certain procedures in which the pain is unavoidable, like the extraction. The patient will always feel the some sort of pressure or some sort of pain, but you can reduce it while communicating with your patient. And always remember, communication is not about the verbal communication, right? Like you can assure your patients in future that if you're feeling pain, then please raise your right hand, and after raising your right hand, count your fingers, etc., and then show me your fingers on like there are 5 fingers, the how many led bulbs are there in the roof, like these things. So you can communicate during the whole procedure. And the study says that if you disrupt those thoughts which are phobia provoking or which are anxiety provoking right from beginning, then the chance of phobia or the anxiety would be much less, right? Next is the highly competent. It is an extension of the expert dentist, that you should have the profound skills regarding the materials, you should have the profound and the good enough skills regarding the procedure, etc. And then the next point is the try to make every meeting as pain free as possible. obviously all procedures are not pain free. Pain is obviously associated with when we are destructing the normal tissues, but the effective communication can negate these pain feelings, right? And obviously, being a doctor, being a good doctor, one should genuinely care about patients. What is the meaning of the genuine care? That you should do your maximum while retaining your professional limits. When we are saying about the professional limit, then the procedure or the communication or everything should not go beyond the drug, disease, and the doctor. And the dentist should have the ability to nurture a patient through the past traumas. Like someone have the extreme phobia, then the dentist must knew certain techniques like the stress relaxation exercises, like a little bit have the idea about the hypnotherapy, etc. So he can better cater a treatment, right? Got it or not? If there is any confusion on this reduction strategies, then please write in the chat box quickly so that I can pursue with the next slides. You guys are there or not? Okay. Is there confusion? Okay, okay. That's good enough. I just thought all of you slept. Okay. So these, okay, good enough, good enough. Okay. So in the previous slides, we talk about the various techniques of the communication. So just have a quick review. To reduce this dental anxiety or this dental phobia, a dentist must have the good communication skills. He must be attached with the communication throughout the treatment. Like it's not about while doing the other procedure we are just taking a history, then we just straight away start a procedure. But while doing the dental procedure, as the patient cannot express him or herself, so we should have developed that various non-verbal communication techniques. Like if you feel pain, then raise your hand, count down the various things. So what is the purpose of all these communication techniques? That as every anxiety or every phobia will start with the thought. So the basic purpose is to modify that thought, to negate with that thought in a proper communication strategy, while developing a proper communication strategy. Got it? We will further elaborate it while we are doing the practical examples, that how you can do it in the practical environment. So let's see, after doing the communication skills, what are the various psychological skills which we can employ to reduce this phobia and the this anxiety. Among them, first is a distraction technique. Always remember, the purpose of every technique, either it is a psychological, either it is a communication technique, is straight away, it's just have a single purpose. What is a single purpose? That one should be able to distract the patient enough that that distracting thought which comes at mind at the start of the procedure, at the start of the phobia, it should be hindered right away. Got it? So for that purpose we have developed the various distraction techniques. We will explain it one by one. Then is the hypnotherapy, and the third is a psychological support and the various sort of counseling techniques. Let's see one by one. Okay, so the purpose of the psychological technique and the counseling, we are doing it in the reverse order, is to discuss the anxieties in a way that can overcome them, right? So counseling involves, as section C is all about the psychological and the social management of the various diseases, various illnesses, right? So every procedure, every aspect will involve the counseling, everything will involve the informational care. But for the exam point of view, your task should be to isolate the purpose of the counseling, the method of the counseling, and the ultimate goal of the counseling, right? So for managing a patient with a dental phobia, these will be the following will be the purposes of the counseling. What you are going to do, you have to explore the origins of fear in the childhood. You have to look at the thinking patterns while taking a dental procedure. What the patient thinks, that this drill is as synonymous as a drill which drill a hole in the wall. So this is the thing, maybe the thinking pattern of the patient. Then you have to do, you have to face the fear gradually, so that the patient would learn. There was a thing which you guys learned in the section C, the classical conditioning and the operant conditioning. You have to deploy those principles right away. Now, then you must teach your patients the various ways to coping, like the relaxation techniques, like the breathing exercises, etc. So, for a patient to whom you're doing counseling regarding the dental phobia, what would be the aim? To explore the origins of the fears among the different about the dentistry, to explore the various sort of thoughts so that we can modify those thoughts, so that we can soothe the negative thoughts, right? And then the courage to face the fear gradually, and then the various ways of the learning to coping, like the coping techniques, like the relaxation techniques, etc. Now, so first strategy was the counseling. This is something which we can do before the starting of the treatment. Like if someone is so much panic, someone is so much phobic, then we can deploy a counseling session with him or her, in which we can explore the various patterns, that how the person is thinking about the treatment. We can explain the goal of the treatment. We can explore the various things. We can teach him the various relaxation exercises which he or she can do while seeking the treatment. Second thing is the distraction techniques, that those techniques which you are deploying while doing a procedure. For example, the aim is the same, to disrupt those negative thoughts. There is no negative thought or there is a positive thought, obviously the physical symptoms would be positive and there would be less phobia. Okay. Among the different distraction techniques are the listening to the music. For children, you can play a movie, you can play a cartoon movie. For example, we can seek help from the dental unit LCD, right, which is deployed over the dental unit, on which you can play the various things. For a child, you can deploy the various cartoons, various movies, and then concentrating on relaxing each part of the body in turn. Like for example, during treatment, give him a command that open your fist and then close your fist to the extent that you are as synonymous that you are facing the anxiety, right? Just count down the number of the LEDs which are blazed over the roof. So again, the purpose is the same, to distract from the negative thought. Okay, like these things we're commonly doing. Next is the another thing is the hypnotherapy. For the hypnotherapy to be deployed, one must be trained in it. It is a separate technique, which you cannot learn your own, right? So at your level, at the undergraduate level, I will just tell you one thing about the hypnotherapy, that it is something, we are generating a state of the trance, trans, trance is something, it is a momentarily dissociation from your current self, right? It's a little bit literary lines, so let me explain in the simple words. We all experience the phase of the trance. It is something which you have experienced while watching your favorite movie, while reading your favorite book. You become just dissociate from this physical world, is it or not? Huh? So this state is known as a trance. While thinking about something that happened at the campus, you just pass by your own home. You have no idea that okay, I just passed 2, 3, or 4 homes away, right? So this state is known as the trance. So the goal of the hypnotherapy is always to generate the trance phase, or to involve the patient in some secondary activity, so that he have no idea of the time, space, and the place. So for this explanation, I guess enough. Obviously hypnotherapy is not for everyone, and everyone cannot conduct this session. You need to be properly trained for it. Like just focus on this these circles at the start of the circle, just focus it for a few seconds. then you will feel that you are indulging in this circle, and you are ignoring the every command from the environment. It is something, it's just an example. Okay, so these, in a nutshell, these are the various techniques. These are moving, but eventually you will become dissociated from your environment. Always remember, for hypnotherapy, your subject should be susceptible for the hypnotherapy. You should be sufficiently trained, and particularly the environment plays a bigger role, like the environment of the procedural environment. So, in nutshell, these are the various ways to reduce the dental anxiety. Quickly go through it as we have discussed it in detail. Okay, now quickly go through the social aspects of the dental treatment. As at the start, someone said the aesthetics, the role of the oral cavity in the aesthetics. From where you learn this aesthetic aspect? She is not cute, at least. Okay, uh, obviously, this concept of aesthetics we have learned in the from the society, that how the people are responding towards the dental aesthetics, or towards a dental smile. Like in certain cultures, maybe the whitish appearance of the tooth may be considered as a taboo, whereas in other cultures, like in our culture, the more the whiter tooth, it means that you have the better oral hygiene, isn't it? In some cultures, the dental jewelry is very common, although if you see the dental jewelry in reality, it looks like that, what you have, what you are wearing, like. So this concept of the static, it comes from the social point of view. The society incorporates in our unconscious mind. We have learned it while living in the culture. People are obviously more conscious about their aesthetics, healthy and attractive smiles, and malocclusion is, yes, it is linked with the negative self image. And especially those people who are with some craniofacial malformations, for example the cleft lip or the cleft palate, they have the low self esteem, they have the low, because they are different from the other people, no? So when they compare their self from the rest of the community, from the other people, then they obviously develop a negative feeling about their self. So the universal criteria regarding the social aspects of the dentistry is that if someone have developed a feeling of the negative self, someone is developing the feeling of the negative complex, then he or she should seek the treatment, the aesthetic treatment, as soon as possible, right? So the only message in the social aspect is that it all dependent upon the cultural guidelines. If the culture expects that one should one should have a healthy smile, and these are the criterias of the healthy smile, then he or she should opt for the dental treatment, he or she should opt for the particularly the aesthetic treatment. Now let's see, there are certain various anxiety disorders that have the direct link with the oral health. Among these include the canker sore, dry mouth, lichen planus, burning mouth syndrome, and the TMJ disorders. TMJ disorder may be experienced by you guys also, while like during exam there is an increased trend of the clicking while opening the mouth. There is an increased these canker sores, or commonly known as the oral ulcers. You will study about all these conditions in detail while studying the oral pathology in the next year, inshallah. But right now, what's the purpose of linking all these things is that there are certain anxiety disorders like the phobia, like the panic attack, like the generalized anxiety disorder, like the post-traumatic stress disorder, PTSD. They also have the oral implication. Under all these anxiety disorders, there is an increased trend of these canker sore, the dry mouth, etc. Why? What is the theory behind it? No one knows the real theory, but the proposed theory is that all these anxiety disorders, they put our immune system, they make our immune system weak. So when our immune system become weak, then we got the those diseases that are particularly linked with our immune status. For example, the lichen planus, for example, the bunny mouth syndrome, for example, the canker sores, etc., and etc. Right? There are certain medications like the antidepressants, like the antipsychotics. These are causing the decreased salivary flow. These are the various examples. In the same way, TMJ pain is particularly linked with the stress that the people are usually experiencing during the exam days. And this doesn't mean that the stress is causing the TMJ pain. No, not at all. Or the stress or the anxieties are causing the canker sore. Not at all. The simple message is that under these stressful conditions, our oral pathologies they become highlighted. That's it. Right? So, what are the various stress reduction techniques as we have labeled at the early? These are just the last slides. So, just focus on it. So, what is the purpose of these stress reduction techniques? To condition the muscle. Okay, so far what we have learned about the dental anxiety, phobia, various causes, various strategies. Among the various strategies, we have discussed about the communication techniques. We have discussed about the various distraction techniques. We have discussed about the hypnotherapy. Then we relate the various stressful conditions with the oral health conditions. Then we related the various social aspects of the dentistry. And then among those stress reducing or those phobia reducing techniques, there was a technique known as the stress reduction technique. So just have a glimpse about it. Then what are these? The purpose of this stress reduction technique is to condition your muscle, your physical muscle, with the relaxation response. Right? Let's see how. So what are the indications? The indications are that uh, if the symptoms, body symptoms come with anxiety, symptoms that are aggravated by anxiety, there is a bruxism or there is a muscle pain, then we apply these stress reduction techniques. There are two types of stress reduction techniques. One is the Jacobson's and other one is the biofeedback. Okay, let me quickly explain it. These are not the rocket science. Jacobson simply states that without monitoring, command your patient that alternatively stretch a muscle then relax it. There is nothing in stretching a muscle and relaxing it, but the message is that while stretching, just imagine that all your stress have been bound in this muscle, and while relaxing, just imagine that you have released all this stress. So with this physical exercise along with this mental exercise, the patient will feel that patient simply become distracted from the original negative thought, as we have discussed in the previous slides. So what will happen that eventually the patient will start developing the relaxation. Whereas in the biofeedback technique or the EMG, electromyographic biofeedback technique, there is a sensor we attach with the muscle. So when the patient stretch it, then it start beeping, and then when the patient relaxes it, then it notify the patient. So basically it's a feedback from the that particular muscle sensor. Got it? So this is the progressive muscle relaxation, the Jacobson technique. We will teach you in the practical demonstrations, and this is the biofeedback, right? Okay, so any questions? Quickly, you have 2 minutes like left. Or it is clear as always, as always. Seriously, no question. Okay, then then just focus on this last slide. And if you have any confusion regarding any term, then please ask me. I'm here. So no question, right? Okay then. Take care. Okay, good enough. So you are also clear about the cognitive restructuring. Okay, we will talk in the obviously in the upcoming lecture. Okay, take care. Allah Hafiz.